Heart problems or an episode of pneumonia are some of the most common conditions bringing the elderly into America's hospitals.
In the last 5.5 years, I've been coming back and forth. Different doctors, different hospitals.
I prefer leaving when I know I'm good.
But what happens to many of these patients in the first 30 days after they go home?
It's a time in which patients are very vulnerable to developing a complication that might end up with them coming back into the hospital.
Dr. Karen Joint from Harvard's Brigham and Women's Hospital and co-authors analyzed data involving more than 3 million Medicare patients admitted to hospitals nationwide from 2006 to 2008 for heart attack, heart failure, and pneumonia. Researchers looked at how many of these patients were readmitted to the hospital during the first 30 days after being discharged.
Black patients overall had a 13% higher odds of readmission than white patients across all 3 conditions.
The study appears in this week's JAMA, Journal of the American Medical Association.
Patients discharged from hospitals that served a high proportion of black patients had about a 25% higher odds of readmissions.
Researchers say understanding why black patients are readmitted to the hospital more often than white patients may help improve the quality of care they receive.
It's a time in which patients often have to adjust to new medications and new physicians sometimes, new follow-up plans, new nutrition plans. And that's a time where we're really seeing a disparity between patients who may have more resources to support them once they come out of the hospital.
Involving family whenever possible may also help in improving patient outcomes.
This is a time to call in the family and the neighbors and really get people to help, trying to help our sort of more vulnerable patients navigate this difficult time.
Catherine Dolf, the JAMA Report.